Welcome back and happy Catterday, everyone. Thank you guys for joining us. I am so excited. I've been looking forward to this day for like 2 months since we planned this thing. I want to welcome all of our amazing cat people who are watching today who want to learn more about combating respiratory issues in cats. And I have the dream team with me today. I have Dr. Amaya Espindola all the way from Mallorca, Spain, and Dr. Katie Kangas from San Diego, California, and the two crazy cat ladies from Las Vegas, Nevada. How are you guys? Feels like a party over here.
Yeah. It does feel like a party. Your countdown is awesome, by the way. I love it.
Well, I give credit tonight to Marissa. She made it.
I was dancing.
That's not my strength, is video stuff. So, as you know,
because she's awesome.
She is awesome. Okay, so I was inspired to do this because number one, I have a cat that struggles with allergies. Now he's so much better than he was in the past, and I've traced it from what I can determine back from over vaccination when he was younger. Just, that immune system out of balance, and then, detoxing all that and the metals and all that stuff out of his body has made a huge difference. But so many people struggle with year-round upper respiratory, lower respiratory issues in their cats. And it feels like we're just playing a whack-a-mole game sometimes. It's like, oh, symptom, try this, symptom, try this. And even the vets kind of, they have like one tool, like, oh, let's put them on prednisone. Let's put them on, whatever, just to stop the symptoms, but they don't ever really get to the root cause. And so that was kind of like my idea behind what can we do to educate people and then empower them to help them find root causes and real solutions to promote healing as best that we can, so that their cats can be symptom free and not be constantly struggling with this kind of issue. So thank you guys so much for being here. And we can talk about product ideas. We can talk about testing kits. We can talk about anything you want to throw at the board. But Adrian, you had a really good question to start with. You want to go with that?
I'm chomping at the bit up in here because I do think, I didn't even know, for our beautiful doctor friends here, what is the difference between an upper respiratory infection and a lower respiratory infection,
and how common is it in cats?
And what
one versus the other?
Yeah, do the symptoms present differently?
Yeah, so I don't know. I'll jump in here. Upper respiratory infection, which veterinarians the acronym we use is URI, upper respiratory infection, extremely common in cats. And upper respiratory refers to the sinuses and the nasal passages, which we call, when that gets inflamed or infected, you may hear the term rhinitis, because that's the term that describes the upper sinuses. In contrast to lower respiratory disease would include your lungs, so your bronchi and your lungs, and that certainly can happen too. Most cats that get respiratory issues, it sort of is present mainly in the upper, or stays in the upper respiratory area. But if it continues and the kitty is not resolving from that, it's possible that could turn into a lung infection or pneumonia. And then the other issue that a lot of cats get is asthma. Asthma is extremely common in cats, that is involving the lungs too. So that's also lower respiratory disease. But asthma is an inflammatory chronic condition, whereas obviously pneumonia or URI, upper respiratory infection, have infectious causes. And if it has asthma, obviously they're more prone to, infection as well. But, asthma is also very similar to chronic bronchitis, which, often occurs in obviously humans and dogs too. So
yes. And I have a really quick story to share. Years ago, when Snow Bear was around, he had feline herpes that I still don't know how he really got that. If it was a real diagnosis or if it was just over vaccination symptoms. But he also developed that kitty bronchitis. That's what the vet called it. Kitty bronchitis. And I remember looking at the x-ray scans and he said, well, there's no real cure for this. And I looked at him and I was thinking, yes, there is. You just don't know what it is. So I went home and I started digging a little bit. I took him off the kibble diet he was on. Do you know his coughing cleared up about 95% within 3 days? Just
Wow.
Just for the food. It's amazing what it can do.
dry food, because it,
And
it's a lot of dust, right? It's dry, it's inflammatory, and all of that. And that was the simplest thing that I did, and I was floored because he would just cough, 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 and have these little bouts. And when he stopped, it was so dramatic. I'm like, what? I was shocked. Anyway,
but also it doesn't matter how you store the kibble,
yeah.
it will always get contaminated, because even if you the only way you can reduce contamination is if you keep it in the fridge.
Mhm.
And avoid plastic containers. So
Yeah.
it makes it very difficult. I have a small one with a high protein just when I go out on holidays, and I have it on my fridge, and it takes a lot of space, because the rest of the time they're having raw diet. But I have it as a treat, and I have it on my fridge. And I understand that it's difficult for people because, they sell you big packages, then it's impossible to store it properly and keep it cold and make sure that it doesn't get contaminated with mold or anything else. And those are the things, when you find allergies in cats, most of the time it's caused by, that contamination on the kibble, which we associate contamination to raw food, but actually it's more common to have it on an open bag of kibble, because it's open. You forget about it. You just roll it up, just put as something in there and keep it. And I've seen terrible things in when I remember I used to do some cat sitter back in the days, and I remember looking at the bags of kibble in the houses, and I was like, I didn't know, but now that I know, I'm horrified of how we store the kibble.
Yeah.
So imagine that, because if a bag comes closed and vacuumed and everything is safe, that's okay while it's closed.
Right.
But once you open that, it's a free field to contaminate.
Yeah.
There is no competition. There's no bacterial competition at all. So it everything can grow in there. So you have to make sure that even if it's processed, you have to keep it very well storage. And that is why allergies, and when you see these, what you just make this small change in food, and suddenly most of the symptoms you don't cure just with food,
Right.
but you reduce the symptoms, the allergic symptoms associated to it. And this is when I get really frustrated when I hear that they say, oh no, this is allergies coming from environment, this is allergies coming from something. And it can, but the main source is always food.
That's
So
crazy. And what's so sad about that is that they're not required to put that on the label. So of course none of us know, right? Like when you're buying a kibble, it says it has a shelf life of like 25 years, right? And to us, right? But
it's very normal food.
To us, it's like, okay, this will be good for a long time. It doesn't say like once you open it, you need to store it. Once it's exposed to oxygen, like it's just going downhill from there. So you have to, you have to take measures, and it's like these types of situations to teach people that that you got to do something about it.
Such a good comment to bring that into our topic, because mold is also becoming more and more recognized in a lot of, as an integrative veterinarians, a lot of pet parents come to me because they know that they have found issues in their household and their own health with mold. And then they're like, oh my God, what's going on for my cat or my dog? And so they are asking for mold testing and all this stuff. So mold is definitely an underlying factor for a lot of chronic, what looks like allergies or respiratory disease of all kinds.
Right.
So,
well, here's another question. How much does like household chemicals play? If we're on like the allergy / respiratory, like how much do the chemicals within our household, the plugins that we use, the little like aerosol sprays, the chemical cleaners, like how much does that play into our cat respiratory allergic reactions?
I would say everything, because but the main problem, and this is difficult to assimilate, because we want to keep our cats safe and having them indoors, but actually indoors alone and not having a space where they can ground or receive sunlight, or they can detoxify of all the things in the house, that is what it's causing this frequency of any kind of infection. We're talking today about respiratory infections, but anything, it weakens the immune system. So it's never building up. So, and I'm not just talking about Wi-Fi or the plugins or the products that you use, because you can change those things, but sometimes it's difficult to, for example, look for fabrics that don't have this to avoid fire. How do you call it? It's to avoid fire. You know,
Fire.
they put sorry,
flame retardants.
Forever chemicals that are in all of these, like even upholstery and plastics and fabrics. Yeah, the forever chemicals are a big deal.
And when you buy toys for cats, it's really difficult to avoid this kind of materials. So this is it's really challenging for people to get clean houses. So my recommendation is that if you can, just get a catio and have some way for them to ground, to receive exposure, because it doesn't matter if you have a lot of sunlight coming into your house through the window, it's not the same.
Yeah.
So you need to get the exposure, you need to get the grounding, you need to get everything that we have to do for ourselves. You know, we talk about this for ourselves: activity, exercise, all those things are necessary to get improve their lifestyle and improve their capacity to defend themselves from any sort of infection, right?
I love that very specific input. And then I'll just follow up with saying that, yes, I think it's well proven, but I was going to say, in my clinical experience, cats are so sensitive to fumes, whether that is litter dust, whether that is sprays, hair sprays, household sprays, candles, incense, all that kind of stuff. I think second to birds. I mean, birds are super sensitive to stuff too. And then cats are seemingly more sensitive than other species to things in the air. And so that plays into not only getting them some fresh air and grounding to help balance them, but also doing the best we can to limit any indoor use of those kinds of things. So
Is there a way, as veterinarians, is there a way that you can quickly diagnose the difference between an allergy, like, let's just say runny eyes, for example? Is this a respiratory infection or is this an allergy? Is there a way that you differentiate? How do you guys go about sleuthing
Testing
through the symptoms?
Yeah, that can be really difficult. And again, they can overlap, because the thing with upper respiratory infections for cats is typically this is from either herpes virus or calicivirus. Herpes is really common. And the unfortunate thing with herpes is that once you get a herpes virus, you pretty much keep it forever, and it lays latent in the body's system. And then when you're stressed or immune suppressed, the symptoms resurface. Even shingles for people like years down the line, herpes related. So that is, an issue that comes into play with that. And so if they're susceptible to a resurgence of, a viral infection or viral symptoms, then that can also overlap with allergies. And an individual could be more prone to then getting allergies because they already have this, weakness in their system if it's coming up, or vice versa. So it can be very linked. And for testing, there's lots of different things you can do for allergy testing, but they have, that has its limitations as well. And then for viral or even bacterial, because sometimes bacterial infections come into play as well, mycoplasma, chlamydia, stuff like that can also be issues for cats. And there are PCR and, nasal swabs or throat swabs and things that can be done to try and test for those things as well.
Yeah,
sorry.
my approach would be I like to test, but most of the time cats are adopted from feral cats or protection services, or they're cats that 80% of the time they're going to be exposed to calicivirus or herpes virus. So I just assume they do have that. if they have it, I just assume, and I try to think about, okay, this is what we're dealing with. In the case of herpes, I know that it's going to be latent, so I try to make sure that immune system is going to be as strong as possible to get, this is what I look at. The test will give you some answers, but I think I will reserve myself for testing, for example, the differences between bronchitis and asthma, which is that you need to identify before you start treating. You need to identify if you have a bacteria or any sort of infection before treating with steroids, for example, right? So those kind of testings are very difficult because most of them they go under anesthesia or sedation, and they're very complicated sometimes. But I will reserve myself for those. And if I think about the upper respiratory infections, I just ask for the clinical history, because you can do a PCR test and identify what is in there, but it doesn't change the fact that you have to strengthen the immune system. So I'm very aware of what I'm going to choose to test to make a difference. I'm going to test if changing the food makes it difficult. If a cat is not easy to transition, I will do more testing just because I need more time, right? Yeah. But this is kind of my approach. I try to look at the whole picture, where the cat comes from, the history, and I try to reduce the amount of testing as possible, because not everybody can. Sometimes it's very difficult. Sometimes cats get stressed at the vet. So I try to be as strategic as I can be with those things.
I would say the same. Like, I haven't done a respiratory, test like that to find, viral or bacterial in a long time. But, if it was really severe and really chronic and symptoms weren't, a lot of internal medicine specialists or, other veterinarians that practice mostly conventional, I mean, that might be a thing that they would do more commonly. Mm-hmm. But oftentimes, like you said, I mean, we know that for a lot of cats being adopted and coming from shelters, that, a latent virus is like your number one suspicion.
Yeah, they just have the weakened immune systems. Let me ask you guys this, because we get this a lot. And I just had one the other day. So cat has all the symptoms of upper respiratory infection, sneezing, coughing, runny eyes, all that stuff. Take them to the vet. The vet has diagnosed as a URI, and they have been through 1, 2, 3 rounds of antibiotics and still not getting a result. What do you say about that?
And speak to the overall conversation too of what us cat parents can do when a vet offers us antibiotics for something that we may not know what the actual root.
Do you want to take it, Katie?
I think we both can. I'll just start out, and I'm sure you're going to want to chime in as well. In that these are the majority of these URIs are viral. So antibiotics are not treating the virus. And yes, they can help with secondary bacterial infections, but more often than not, that is not necessary. And then we're just hitting them with antibiotics and, affecting their microbiome and weakening their immune system even more. And so more often than not, antibiotics are inappropriate to actually treat URI. Now, if bacteria, if they're super green snot, or they get a, fever, or the testing is done and they do find a bacterial component, then, then it could be appropriate. But definitely just to use antibiotics pretty, routinely for a URI would not be advised for cats.
And you said something very interesting, that it's loads of different rounds of antibiotic. That means it's not helping, and you're destroying the microbiome.
Ding 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 ding. Yeah, not helping. Yeah.
So my goal would be, it's best even to find a good probiotic or find a good way to strengthen the microbiome in general, especially in the gut, because in the gut is where, yeah, exactly, there you go. You can find some FMT if you want.
Yeah.
And strengthen from there. And as Katie said, if you have a noticeable infection or fever, then okay, we use antibiotic, but not, we have to be careful. It's not for the virus, it's for the symptoms that they are currently having.
Yeah.
That's all. You're just making them feel better, right? And
Right.
then you have to find a ways to improve their immune system, because that's what you can do with viruses.
Well, so there's the question. So what, and we have that in the comments here. What recommendations do you guys have as veterinarians to help build the immune system if you have a cat that, say, has these chronic issues, or they're constantly, in and out of the vet's office for this?
Yep.
For me,
yeah, go ahead.
For me, it's food. The first thing is food. It's always food. If it's difficult to transition the cat, as I said before, I'll just put the kibble in the fridge and start having measures to improve that, to improve the water intake, to support the gut with probiotic or postbiotics, or different, depending on what it's needed at the time. If I can, because in Spain we don't have really easy access to FMT yet. I'm just looking to find a place and start doing it myself, It's really difficult. But that would be my first intake. I don't know if you want to say something, Katie, about it, and then I have other things.
I would say I was kind of thinking of some top 5 things, and food definitely same, because food is the best medicine, and so health literally starts with the foundation of food first. But another piece of this conversation, which is a whole nother topic, but in order to support good immune system, reducing stress as much as we can, because we know that stress is going to bring this on. So that's a whole nother great topic to talk about. But
Number 2,
species appropriate, great diet, and then reduction of stress. And then beyond that, my next top 3 things that I would mention would be mushrooms. And so we can talk about that, because that's really great. And of course, Jay and Adrian carry some great mushroom product for kitties. The Breathe would be perfect to talk about. But 2 other biggies that I love to bring up, because I'm so big on testing for nutrient deficiencies, because I find in my clinical experience that is so impactful for overall health, definitely for resilience to infection of any kind, whether it's bacterial or viral. But 8 out of 10 cats and dogs are deficient in vitamin D, and that's huge. And many people know that if our vitamin D is low, we are less resilient to catching infections of any kind. Yes. But if our vitamin D is low, we are also less able to resolve any inflammation patterns in the body. So when you're talking chronic inflammation, whether that's from viral organisms being latent, or whether that's from I have asthma, or I have allergies, or I have, a certain weakened system in my body, everything that's chronic is at base level inflammation, based. So it's really important to have proper levels of vitamin D. And so I always encourage people to get that tested. And then the last thing that I would add here too is omega-3s. Huge.
Yes,
and I you guys, Danny,
I like the way you think.
doing some testing on omega-3s in kitties now, so we can go off on that amazing tangent. But I will just say that omega-3 fatty acids, DHA and EPA, are significantly impactful to the whole body, definitely to inflammation, but also the immune system, and known to directly be beneficial for so many specific systems. But really, it's everything. But everybody knows, like heart, brain, skin, joint, kidneys, etc. But dental health, I mean, you name it. So omega-3s are a superstar in the lineup of either food medicine or supplement too. So
yes, I would add minerals, because sometimes when you individualize, this is something that I've been working on the past few years about about how minerals interact with each other. So it's not just about finding a supplement that will give you any sort of mineral, but usually I use algae or seaweed or any plant. I try to find things that are compounds that are all together, because if you supplement with, let's say magnesium alone or anything alone, you don't know how the body's going to react. But at the same time, viral infections usually take more because they need to feed themselves. So they take vitamin D. Or herpes, for example, eats a lot of vitamin D, and other our viral infections will take more minerals. And you are maybe feeding a really good diet, but you need more minerals to support a cat that needs, that has a viral infection going on, and especially if it's going to be like a herpes forever, latent or not, it's going to be there forever. So what I look at is I do periods of mineral intake, or sometimes I use filter seawater, or I find different sources of compounds of minerals. And I don't do it chronically forever. I just do periods of it to see if there is an improvement, because testing of them, you can do mineralograms. You can test the hair, which is amazing testing. You can look for heavy metals. You can look if there are deficiencies. It's great. But if it's not possible for you, then you can add minerals and see if there is a response from the body, reduce of symptoms. And that, for me, after all you said, Kay, because I agree completely. I love mushrooms. I love omega-3s. I think cats totally need a lot of omega-3s because they don't convert from omega-6 really well. Right. So if you feed good foods and if you are minded about, I always like to think that the body is more like a combination of things, are like a civilization, and then you have a virus that is taking more than it should, so that's the way I like to think about the gut, everything. I like to think about, okay, I have this virus is going to live with the cat forever. So now this is what individually what the cat needs, or this is what, that's the way I like to think about my patients when they suffer these chronic conditions.
Yep. That's a great way of looking at it. And I do see a lot of trace mineral deficiencies too. And that's something that I like to test for. Magnesium is easiest to test for with blood work. Yes. But as you mentioned, the hair analysis test you can get a much more comprehensive profile and accurate picture of what's going on there.
Yes. And Dr. Katie, you had mentioned something before we started, that our favorite product, Ion Gut Support for Pets.
Oh, thank you. That
is also a trace of source minerals.
I'm glad you brought that up, because that, when I was listing out my top 5, this would be like right up in there.
Yeah, show it.
And I brought, for a little show and tell, this Ion product, which is gut support for pets. And of course, there's a human version as well. That it's claimed to fame is for gut health, but it's also for sinus and airway health as well as kidney health. And the reason is because those tight cellular junctions, most people are familiar with what leaky gut is. Those tight, the cells that line the gut lining have the tight junctions, but those same mucosal type barriers that line the gut also line the airways, the sinuses, and the respiratory tract, and also line the kidney tubules. And so when kitties or humans are taking this product, it is helping to keep those tight cellular junctions intact, which is protecting the immune system, because behind all those mucosal barriers is where 80% of our immune system lies, in a long lymphatic tract of tissue right behind there. So when those barriers are sealed and we have better gatekeeper in our respiratory tract, in our gut, that means we're not having leaky sinuses, because when we're inhaling, kitties are sensitive to the dusts and the fumes and all that. And then those of us that go outside, we're getting the glyphosate being sprayed, and we're, getting all this stuff. And when your mucosal barriers in your airways and sinuses are intact, then your immune system is more protected, and you're less likely to get allergies in the first place, and less likely to get inflammation, which could set the stage for then, I get my latent virus back because I got inflammation up here because I'm affected by whatever I'm breathing in. So this stuff is golden.
I love your brain.
Oh, thank you. a good collection of brains right here. So, yeah.
So would you both say that the reason that cats seem, there's like cold and flu season, right? Like, and they say that it's just the same for, dogs, cats, humans, like it's cold and flu season. But for us, it seems like we see cats having this year round. Like, it seems like these respiratory issues are happening all the time. Would you guys say probably the number one cause of that is the weakened immune system, is just because our cats aren't, I don't know what the word is, but we don't support the immune system well enough, or know enough to support the immune system in the.
And I would say stress as well, because it's very difficult to know, if the cat is, doing well at home. Sometimes there are signs that you can tell, but there are other things that is more difficult to see. Or if you are going from even when we change from winter to autumn or summer or anything, any season, we change our our mindset. The sun is coming more often, or it's late. You get a late dawn. All those things can change the environment for the cat as well. What you are experiencing, the environment for the cat, and everything. So you have to keep in mind that, for me, environment is one of the biggest, after food especially. But I would say environment is the biggest changes. I don't believe there is a flu season. I believe we have our immune systems really down, which is susceptible to anything.
Mm-hmm.
Yeah.
Wow, that's a very good point.
That's pretty accurate. But in another little twist or contrast is that a lot of times when humans are getting their, cold and flu, it's a new virus, because the colds that we get are like ever changing viruses that are constantly, changing through the strain and all that kind of stuff. Whereas when cats are getting cold and flu, it's not because they just unless they got it because they went to the shelter, but then for the rest of their life, it's just resurfacing from what they had before. So it's not a typical cold and flu season, like, oh, I went out and caught this new virus. It's like, dude, I've had this virus for 7 years and it's resurfacing now because I'm inhaling a lot of fumes in my house, or, I'm stressed or whatever. And so really for cats, I think one of the best things we can do, everything we just said with supporting the immune, it's really two-pronged: supporting the immune system and reducing stress as best as we can. And there's ways to do that. And we talked about the outdoor and grounding, patio, and all that kind of stuff. And, again, the best that we can. We're human and there's a lot of stress in the world, but recognizing that our stress is sensed by our pets too. So doing everything we can, meditate with your kitty, the music, the handpan music, right? Woohoo! All kinds of things that we can do to, address that piece of it, which is so big.
That is awesome, because my other question was actually going to be follow up to that. Was we have so many people that are like, how did my cat catch a respiratory virus when they're indoor only? And that would make sense, that it's lying dormant for so long, and it's just coming back up because of the environment.
Yeah, and I will share. I was a shelter vet for almost 15 years, and I was overlapping that while I was doing my holistic training. I was still working part-time at the shelter, but I was a full-time shelter vet for years. So I have seen URI like no other. That is the biggest nemesis for cats in a shelter situation, clearly, is upper respiratory. So it can get so severe because they're so stressed in that environment. And so the vast majority of pet kitties have been adopted from a shelter or a cattery or a rescue group or whatever. And I don't know if anybody's done statistic numbers on that, but I would wager to say 80 to 90% of them at least have had a herpes virus or a respiratory virus or even bacterial at some point. So you got to assume that most domestic kitties, if they're not surfacing with respiratory, then you're doing something right, because it is such a common thing that can happen with them.
I want to add something to something that you guys were just talking about. I've had the amazing pleasure of interviewing Dr. Richard Pitcairn, who was considered the doctor of homeopathy, the father of homeopathy for pets, right? And one of his articles that he wrote back in the 90s talked about vaccinosis and chronic disease linked to overvaccination and how pets can actually start to develop the same type of symptoms of the viruses that they're being vaccinated for. And I see that a lot with shelter cats who are just, they don't check them when they're surrendered. Did have you had vaccines in the past? They just revaccinate them and then they send them home. And then they get into this cycle of vaccine every year, every 3 years, like all the time. And you see the same type of upper respiratory problems with cats who are over vaccinated and dogs too. But it's just, I think that's a huge part of the problem.
I'm so glad you brought that up.
Yeah.
I tell people all the time, there is absolutely no need for vaccinations for indoor cats.
Yeah.
And even outdoor. I mean, honestly, we can expand that conversation.
Yeah, okay.
That's a slam dunk right there. Like that's just a no-brainer.
Yeah.
But even once they're established, they're older, they've had the kitten series or even not, they're gonna have natural immunity. I mean, even if they go outdoors, I still wouldn't vaccinate them. But certainly for indoor cats, it's like it shouldn't even be considered. So, and you can do titer testing and things like that, but I generally tell people just you can absolutely avoid vaccines, and you should.
Yes, especially with cats who have viruses, they shouldn't be vaccinated ever. Because you're just disturbing the course every time.
I like to individualize. Well, most of the things I do, it's individualized, but I look at the stress levels. I look at if the cat is indoor but lives with of the person it works at a shelter. I do see sometimes that if you never vaccinate, something happens. But at the same time, I always see over vaccination with cats that are not ready to receive a vaccine, because you need to make sure that they are fully developed, ready to receive something, because they need to, the vaccine is not a medicine. The vaccine will provoke a reaction in the body. So the body needs to be aware and ready to create that adapted measure. It's just that we give the vaccine like, oh no, it's a solution for everything, and no, it's just adaptive. It's adapting the body to the environment. So you need to look at the environment. Is there a risk or is it not? And after that, you make those decisions. You start asking questions. How often do I need to do it now? Those kind of things.
Follow-up question on vaccines, and I think this is something that is really exciting to talk about. For you to say the cat needs to be ready to receive the vaccine, right? Like our cats have had the kitten series, right? And we space them out as much as possible. So we know that if there's any kind of reaction or change, we know which one it was that bothered them. Can you guys expound on what it means to be ready, as far as health, as far as age, as far as what do you mean by that?
Yeah, what is fully developed? If it just
just if there's a cat that just shows up, like we had Annie show up, we knew that she was probably about 7 months old, and she was not spayed. We took her to the veterinarian and they said, well, she's not spayed, she's not vaccinated, so we'll just go ahead and do it all at once. And we said, no, we would really like a titer test, because we lived through having one of our cats be over vaccinated and developing, just like Pam said, and thank you, Pam, for helping us work through that, develop terrible disease, autoimmune disease.
Well, I can give you an example of how I would do it. For example, if you find a cat that you found it on the trash, and the cat hasn't not taken any colostrum, it doesn't have anything to defend themselves. Well, you will have to wait a little bit longer to make sure you just put the foundations there as much as you can, and then vaccinate. I know some people would say, oh, but the cat cannot defend themselves because, he hasn't got any colostrum. Yeah, but if you vaccinate and the cat is not ready because he hasn't received all the nutrients that he needed from the start, and of course that causes stress. So you have both of the first two things that we were talking about. already in the list. So that will make a cat not ready to be vaccinated from the start. You just need to adapt the cat in the new home, make sure he's safe, not put it with other cats. Just make sure it's safe. Make sure that he gets the proper food, gets a little bit of colostrum, gets a lot of omega-3s, and gets everything there. And once you see that cat is transforming from that little rat you found on the trash and starts to look like a cat, then you can start thinking about, okay, let's start doing the vaccination. And I will space them a lot from one to the other just to check how they react. Also choosing the best, the brand of the vaccine, which you not always get the chance to. Sometimes they put the cheapest one, and I have my favorite brand, and I always say, this is the brand you have to use, and this is the type of, sometimes they mix too many vaccines in one to make it easier.
Yeah.
No, don't look for that in this type of cats. Just make sure to tack on any the smallest thing just to get it right there whenever you get there, because it doesn't matter how slow you do it, as long as you are aware of what's going on, right? And how the cat is developed. And the other thing that how you see a cat developing is the nervous system. And one way to look at it is how they look at the how they adapt to the environment, how they if they can eat on their own, if they interact with other cats. So you need to look at the cat needs to be fully developed on the nervous system. He has to be ready to face things, playing. He has to be active. If the cat is not there, then again, wait a little bit. It's not going to harm them.
Yeah, being ready for a vaccine means you're not ill. Like, that's one of my biggest, issues with, many veterinarians, conventional veterinarians, is that they'll vaccinate on any visit, whether the pet is healthy or ill.
Yeah.
Or injured.
Ill or injured.
Injured, has an infection. It's got a raging dermatitis, skin infection, whatever, and they'll, do a vaccination. And so it says, right, of course, on the inserts in the literature and the vaccination, that this is for healthy animals.
Yes.
So when somebody's already ill, they're not ready for, a vaccine and develop, to the point where you would want to do that. And then I also, second the discussion on separating vaccines and not doing multiple vaccines in the same day, like a leukemia and a rabies and a FERS, all at the same time. So definitely separate them. Healthy situation where you're not under a lot of stress and you're certainly not demonstrating, disease or illness. And then as far as age, not doing them too young, preferably. I mean, again, a lot of people get their kitties later and they don't have a choice in this, for sure. But, the more limited vaccine strategies, even for the kitten series or, puppy series, is to start at 10 weeks, 8 to 10 weeks. And not 5 to 6 weeks, because then their immune system, again, isn't very developed, and you can actually suppress their immune system the younger you start them. So, and the other, little tidbit to that too is that they still have maternal antibody at that age. They're getting maternal antibody, if they nursed at all, and even from placental transfer, they're getting antibodies from the mom, and then those antibodies start to fade away over, time, and that's individual, where you could have a litter of, several kittens, and maternal antibody will fade, somewhere between 9 and 12 weeks, essentially. And so that's the whole reason for the series, is that if you give a vaccine and maternal antibody is still present in that kitten's body, then that's going to block the effect of the vaccine. As they've already got those antibodies, and the whole point of the vaccine is to trigger the kitty's immune system to create antibodies to that, so that they're immune to it from forward. And so we need to wait for maternal antibody to be gone to really, for that vaccine to take effect. And that's why that series is done. But pushing it back to a little bit later is much better for their immune system, and it's more likely that the vaccine is actually going to take effect too. So
one of the things that I have found to be like super, super stressful with kitties is just the presence of the heavy metals in their bodies from these vaccinations. And, people can give their cat milk thistle after vaccines or, things like that to support the liver, but they never think about doing it a step further and go, let's clean out all of the formaldehyde and the polysorbate 80 or the glyphosate that's in that and the aluminum and the thimerosal and all the garbage that they put in those to be adjuvants, right?
Yes,
So do you guys have your favorite products? Apparently.
thank you, Jane.
Thank
Thank
you.
you so much. So yeah, that's my product, the Vtox. I also have the Vtox R for rabies, vaccine,
Awesome.
but yes, the adjuvants and the heavy metals that are added to these vaccines are a big issue. And so a vaccine detox, I always recommend after any vaccine. And one of the advantages of these homeopathic formulas is to help drain the lymphatic system because, liver support, obviously very good. Liver and kidneys are our main detoxifying organs as far as clearing and filtering. But if the lymphatic system isn't working well, you can't get rid of it. So it just keeps circulating, and we really need that lymphatic system to do its job. And so these homeopathic formulas also work on that piece with lymphatic drainage as well.
Very
And
important.
also when they use molecules of animal proteins such as chicken or beef, so most of the time you will get allergies afterwards of those proteins because you use them on vaccines. So the common sense would go, for example, if you have any respiratory issues, then the first things I will going to try to get out of the diet is chicken and beef first, if I know the cat has been over vaccinated. It's not always the case, but that's where I'm going to go because I always minded of the damage of the vaccines, especially if they tell. And I'm really sad when somebody tells me, "Oh, I do the vaccinations every year," and I'm like,
I know they're so proud of themselves.
yes,
It's the right thing to do.
and the thing is that they feel really guilty. I'm working a lot with the guilt with people because if you don't vaccinate your cat, then you're going to go to the vet and the vet is going to yell at you, say that you are a responsible person not doing this and that. And it's really sad. But if you want to defend yourself, you do titer testing. I don't do it because no, I'm not going to vaccinate my cats unless I have to travel. Otherwise, I won't do it anymore. But if you need to do, just opt for titer testing instead of vaccination, and then you will have something to say to your vet, right? And say, look, I don't vaccinate because they are okay. All right.
I'm curious, Adrian, you were bringing up the 7-month-old kitty that you adopted, rescued. What were the titer test results for your kitty?
She said 5 times over. She said, I would allow her to literally fly internationally.
I can clear her for international travel.
Yeah, she will never need a rabies
And
vaccine again.
that was for the rabies vaccine. But
and she is a conventional vet. And this was the first time she ever did a titer test because nobody had ever asked her for that before.
Wow, good. You changed her mind.
Isn't that great? Because then that assumption that she wasn't spayed, so she must not have immunity, that was nice to see that assumption isn't always going to hold true. So sometimes it might be the case, but it's definitely not always the case. So
I had this overwhelming feeling of gratitude, to you, Pam, for pulling off this event, and for both of you, beautiful veterinarians. I see in the comments people having difficult experiences at the veterinarian's office. I saw one for fleas, which I know is heartbreaking, or vaccinating if your cat has a health condition. You guys I know that there's so much that we're talking about, whether it's vaccines, antibiotics, whatever it may be, flea medications, where you feel like there's an argument or you feel embarrassed or you feel like some kind of conflict. You guys are really empowering us. It is this information from these veterinarians that are continuing to help inform all of us, that make us confident saying, no, we really do want the titer test. No, we are not going to do the vaccine, but be able to have a compassionate conversation with our veterinarian, because they could be the next you guys, right? Just taking that time to think and really consider the individual pet in front of them. So I'm just so grateful for you.
Well said, and thank you.
Thank you. I really enjoyed these meetings as well.
Yeah.
Because
So I want to just highlight Jane Adrian's products. You have some really good products for respiratory issues.
Vira X.
Vira X, Oxycat. I mean,
Yes.
talk about
Our
some
mosquitoes had herpes, and that's really how we found out.
Yeah.
We did, it was he had the herpes virus that was dormant for so long that he would have flare-ups, which were
Always during
really-
stressful times.
yeah,
Right.
always.
It was typically when we would go out of town or we were super stressed. There was something, big happening. He would get the watery eyes that, it would flare up. So yeah, I mean, there's a lot of good products. A lot of people in the comments are talking about lysine. So I would love for you guys to talk about that a little bit too. Because that's like the number one, go to. We don't have that, but we use our Vira X, our Oxycat, and our Breathe, which is the mushroom formula to help with respiratory issues in our kitties.
But speak to lysine, because a number of people mentioned in the comments. I see it.
Yeah, I was going to say we should definitely bring that up, and I'm curious to hear what Dr. Amaya has to say about it too. But I will tell you that, well, first of all, I'll describe that L-lysine is an amino acid that actually competes with arginine, and herpes virus needs arginine to replicate. So when they're taking L-lysine, it should help to reduce the replication of the herpes virus, and therefore the viral duration should be shortened and the severity, should be shortened, etc. So as far as clinically, I've seen mixed results with that. And I will tell you that, and granted, I was a shelter vet, we're talking like 20 years ago. So maybe, some things have changed. But when I was a shelter vet, we used L-lysine like it was, going on style. And we didn't appear to, like, we actually did like a clinical study, the cats that weren't getting it and the cats that were getting it. And we really didn't see a statistical difference.
Yes.
That said, these cats were in the most stressful environment they could possibly be in. So, that in a home situation may work very differently. And I would say that through the years, from clinical experience working with pets, I've had probably at least 50% of clients that use L-lysine think it's helping. So maybe in a home environment situation where the stress isn't through the roof, and at the very least, it shouldn't hurt, so I mean, might as well do it if it's not too stressful to give to the kitty, if they're tolerant of taking it, and all that has been my take on it. And I think there's just a little bit of variable results, and I'd love to hear what Dr. Amaya says.
Yeah,
too.
totally agree with you. Also, you can get lysine from food. I mean, it's not something that you need necessarily to supplement, but as Katie said, it helps to avoid the replication of herpes. So that is why we supplement it. So again, we need to be mindful while we're using it. We're using it to avoid that, but not necessarily that is going to be helpful. I don't, most of the time I keep lysine in the supplement list because the clients won't give it up. It's like, I'm just going to just try other things. I have, mushrooms can do a lot of things. Vitamin C can help you, reduce the stress, can help you in many ways to enhance the immune system. Okay, let's do that instead of lysine, and they cannot give it up, And so if you feed good food, I had better results with lysine if you add it. First of all, if it's herpes, because with calicivirus, I don't have good results at all. So if you know that you have a herpes or you have those frequent flare-ups, it helps during that time. But that's it. Then you can stop it. You can stop for a while, try other things to enhance the general immune system. And if you have another flare-up, you can go back to your lysine if you like.
I love that you worded it that way. I'm so glad you brought that little aspect in, because what I love to share with my clients is really giving people the perspective of the highest priorities, because especially with cats, because typically with cats, I'm like, less is more. And it's so easy with dogs to do like a dozen supplements and,
just put it on the food. But with cats, you need a training.
You really got to pick and choose where your priorities are. And
Yeah.
even though L-lysine, no problem in doing that, and it may help, but for the iffy-ish results that I see with it, I would definitely prioritize several other things before that. And like you called out, the mushrooms and even, the omega-3s, the ion, making sure vitamin D is okay. Those things are going to impact more than L-lysine will.
Exactly.
I have to share this real quick because you guys know I'm like the queen of muscle testing and I test everything. And I would say almost all of the cases, they're the clients that I've helped in terms of energy testing, a supplement like lysine, it's only been 50% beneficial. And that lines up with what you said, Katie. It works about 50% of the time. And the other thing that made me think of is it really only works if it's feline herpes. But if it is calicivirus and you think it's herpes, but it's really not, so it's not helping. So take it off the list. Don't use it. If it's only giving you 50% benefit, to me, it's not high enough. I want something 90 to 100, or I don't know.
And the other little spin on that is that even if it is herpes and it's helping with the replication, it's only doing that. Whereas the mushrooms and the trees and the antioxidants and the food, they're affecting the entire body.
Yeah, it's a synergistic effect.
Way more bang for the buck.
Absolutely.
So,
absolutely. Yeah, that's amazing.
I love it.
Totally.
Do you guys have any other favorite products? I don't know. Obviously, herbs, things like that. I think Katie, you had
a couple of things. Thank you. I had a couple of things jotted down. And one of the things I wanted to mention is marshmallow root is a superstar with inflammation in mucosal surfaces, mucosal lining. So many people may know that marshmallow root is in a lot of gut health products.
Yeah.
Because it's certainly good for IBD or inflammation in the GI tract anywhere, or colon, colitis, all that kind of stuff. But marshmallow root is in a lot of respiratory formulas as well, because it's very good for inflammation in the mucosa of the sinuses and and the lungs and lower respiratory system. So there are a lot of, products that are out there. Animal Essentials is one of the brands that I really love and I use a lot. And this is a fun, tidbit, is their hairball relief is just marshmallow root.
Yeah.
And they actually label it either marshmallow root or hairball. It's the same thing. It's just marshmallow root. But it's labeled hairball relief. It's also very good for the respiratory system. And the reason that it's labeled hairball relief is because not only is marshmallow very soothing to mucosal surfaces, but it's also an intestinal motility stimulator. So it helps push hair through the digestive tract, to come out, better with bowel movements than getting stuck up, in the system. So the hairball relief or marshmallow root is a wonderful addition to be aware of. So
that's awesome.
Yeah.
I would say, well, the thing is that living in Spain, it gives me a Spanish products, but I do love the two products. One, it's a combination, a blend of mushrooms, but the particular of this products is that it is a human mushroom company that developed fermented mushrooms for cats. And they can tell you, now they are developing they're looking to develop antibiotics coming from, the antibiotic effect from different mushrooms. So they are really into the science of these things. And the fermented mushrooms, what they do is that you get the effect much faster than with any other. So they combine, for example, they have one, it's called Immune Pet, and it is a combination of different mushrooms, all fermented. And then they add some echinacea or any other. It depends on, I don't remember exactly what but they have the different herbs to enhance the immune system, and it works really well. Sometimes if they have a lot of mucus or things, I use polyporous, which is a human mushroom. They usually is not, actually I haven't seen any brand for pets, but it helps to break down the mucus and make sure it's expelled. And then the other product that I often use, I forgot another name. I had it on my mind and I just forgot it. Well, it will come back to me. Postbiotics. It's the University of Madrid developed a postbiotics, which actually is really easy to feed because it's liquid.
Oh,
It's just a few drops,
Mhm.
and cats love it. So that for me, using good probiotics, using and in the UK you get some others directly nasal probiotics to help that, make sure that you don't get secondary infections or reduce the mucus. So those are my favorite products alongside all the others, that we talked about, our main
Yep.
goals.
Yeah.
love
Good.
it.
I'll mention one more that I thought of too that I listed, just because stress is such a big component, and
Mhm.
I'll tie this to mushrooms because many of the mushrooms are adaptogens, like the cordyceps, which is not only
Mhm.
good for respiratory, so it's in the breathe formula, but cordyceps is a good adaptogen, so that helps the body to deal with stress better too. But also cannabinoids, a CBD
Yeah.
has so much application because it's anti-inflammatory, so it's helping with inflammation. And then it's also very mood supportive for stress or anxiety. And it has a lot of other, benefits to it too. So I love CBD for, many reasons. And it tends to be a good match for kitties as well.
Yeah.
Yeah.
Awesome.
One of the things that I use a lot is homeopathy, because
Yeah.
I'm a remedy with water and it's easy to use with cats, but you can match the symptoms, whether it's congestion or runny nose or, what, even as like, if you see the yellow snot or homeopathy is so amazing. I am such a fan and have learned so much from the homeopathic vets that I've followed and learned from. But wow, if we can really dive into some homeopathy for the cats, it's quick, it's easy, and they don't fight it.
Mhm.
It tastes bad, right?
Yep.
Mhm.
There is a misconception that homeopathy will take longer than the other, but it's
Actually,
it's not.
It's quick.
It's actually quicker. So I just wanted to say that because usually I get this idea of, oh, homeopathy works slower. No, not really.
Yeah, I love
When you
homeopathy.
get it right, when you get the right remedy, it's like bam,
Yeah.
it's wild. But
Yeah.
I love it.
Same. A whole other cool category. And it's
It's
nice
really-
to overlap and do a little, but again, priorities, but picking something from the homeopathy category, obviously food is a big thing. And
Yeah.
then omega-3s and mushrooms. I mean, taking things from different categories and doing a small collection of tools is going to get the better outcome than just picking one thing. And, and homeopathy is such a good tool in that lineup.
Mhm. Absolutely. I cannot believe we're at an hour. I want to go around the horn here and just let you guys give final thoughts and where people can follow you, and if you have anything coming up that you want to promote. We need to share more with these amazing cat people who are here.
Okay.
Maya.
All right. So what I would say is that because we talked a lot about upper respiratory issues, but one of the things I find the most is that making that differential diagnosis from asthma and bronchitis. So you may have to get that BAL ball treatment and get, find the bacteria, that if there's a bacteria there.
Yeah.
Because if you treat with steroids without having that, you can actually cause more damage than actually being helped. Maybe you see a reduction of symptoms, but it's just going to be for a short period of time.
Yep.
And then for stress, which this is where it gets, where my new things coming up, I created lullabies for cats, and I'm using a lot of sound therapy. So I decided to use my voice because the voice has more connection to your cats than any other sound in the brain, than any other music. But I use all of them. I use my lullabies. I use bioacoustics, which is nature sounds with different frequencies. And then you can use maybe a song that you like, because as long as it relaxes you and relaxes the environment, the frequencies can be helpful. But if you want to check my lullabies, it's you can just look for lullabiesforcats.com, and you will find 3 recorded in Spanish and 3 in English, which are the same songs, just changed. And the idea is for you to sing them. You don't have to be an expert. You just simply have to connect, be present, and start talking to your cat in a different way, because that is the best, even if the world is burning outside. But if you have a really good connection with your cat, you're gonna make most of the stressful triggers disappear. So we have a lot of power there, and this is what I wanted to say. You can find me at Velvet for Cats on Instagram, or velvet.co.uk, or amayaspindola.com as well. So check for all those things, and I'll be happy to talk to you.
Yeah. And I totally forgot that we didn't talk about the asthma. Dr. Katie, do you have anything you want
to share? So I'm so glad Dr. Amaya brought that up. Both of the things you talked about, I'll speak to the first one. Is I agree, asthma and lower respiratory disease, even though it's a little, it's less common than URIs, it's still quite common. And what my little nugget of advice for people would be that if your cat is coughing, get a chest x-ray. Usually upper respiratory is going to be more ocular and nasal symptoms, and the congestion and the sneeziness and the snottiness. But if they're coughing, could be hairballs, but a lot of times it's lower respiratory. So get an x-ray, because that's the best way to figure out what's obviously going on in the lungs. So that would be my little tidbit there. And then, it's a whole nother discussion about what to treat and that. But everything we talked about in supporting the immune system applies for asthma as well. So that's all great there. I am so glad, Amaya, that you brought up sound therapy. That is such an up and coming, amazing healing, modality, and, all kinds of lectures. Even Dr. Barry Sands is going to be lecturing on sound therapy at AHVMA this year. And Jane Adrian know her very well.
Yeah.
Sound therapy is big, and it's effective. So yay to
it's
you.
Really effective.
Something, so current, cutting edge healing that people can tap into. That's going to make such a difference. So I really appreciate that, and I didn't know you were doing that. So I'm really excited.
Yeah, that's what I'm looking to go to, because it's important. We live in a contaminated world in many ways, not just the products, the chemical products, but the sounds, the noises outside, everything. It's becoming more noisy. So you need to create the environment from all the perspectives that you can. And music is my thing. So that's just combining my two passions.
I love it, because all the stuff we talked about, so worthy, but you get into sound healing and it's all energy and vibration. And that's like a whole nother level of tapping into
another episode.
It is. It literally be a whole other podcast on specifically because it's so true, right? I did a thesis on music therapy in college, and it has been like, you can ask this one because she likes silence and I like calming music. So I will listen to, and she's the musician, but I will listen to like music all day long to keep myself in check. And we noticed the different the difference in our cats too. So thank you.
Yes, great. I'm glad it helped.
And then the last thing from me that I'll say for everybody is that I do offer telemedicine. So I love helping people that are near and far to me. And people can find me at intvetcare.com, because my practice name, Integrated Veterinary Care. We don't want anybody have to spell integrative or veterinary. And so intvetcare.com, and, Instagram and Facebook as well. So if anyone wants to find me, I'd be thrilled to work with you individually or, through contributions like this. So thank you for having me.
Absolutely.
Awesome. For us, we're just really grateful to be here. Like we're so grateful to be able to, when we were like Dr. Amaya and Dr. Katie, like together, no way. Like, this is awesome. Yeah. Thank you so much, because you are completely correct. This is an under talked about topic in the cat world that I think should be addressed much more often. So thank you for bringing that up. We are the Two Crazy Cat Ladies. You can find us on the Two Crazy Cat Ladies on Facebook, Instagram, YouTube, TikTok, and our website is twocrazycatladies.com. That's TWO Crazy Cat Ladies.
Bigger than that, though. In 50 minutes from now.
So 50 minutes, our big reveal is coming. We will be live on Facebook, YouTube, and Instagram. So what we've been teasing for a few weeks now is finally going to be revealed in less than an hour. So come join us back.
stuff. Love, love, love.
That's right.
Yeah.
That is awesome. That is awesome. Well, thank you guys so much. And I'm sorry we didn't have time to address all the comments, but I did want to thank a very special guest all the way from Canada named Rodney.
I was about to lose it with the Canadian gentleman and his American friend with the large
hair.
I can't. I was.
We
trying
almost
so
peed ourselves.
hard.
We were trying to get us together, but we almost peed.
I know, me too.
That's good to have.
I was dying. So thank you guys so much. And if you have friends with cats who struggle with this issue, share this video.
Yeah.
It's being streamed, I know, on Jane Adrian's channel and my channels as well. And so you can easily grab a link and share that out. The more people we can empower and educate, the better. And that's why we wanted to do something like this. But thank you guys so much. We'll put together another really cool show in the near future. Maybe on sound therapy. That's a really
Yes.
I'll be happy.
here. Yes. Okay, awesome. So you guys have a wonderful rest of your weekend. Thank you so much. And tune in for Jane Adrian's big live reveal in about 45 minutes from now. Okay, so
Yay.
bye.
Bye.
Bye.